Prior to beginning the activity, please be sure to review the faculty information and disclosure statements, as well as the learning objectives. After listening to the activity, complete the post-test by clicking the Earn Credit link in the episode description. Downloadable slides and resources are also available. The following presentation is copyrighted by Medscape. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of Medscape.
The following presentation is part of a certified educational activity provided by Medscape Education and supported by an independent educational grant from Pfizer.
Hello everyone, I'm Jörg Schelling. I'm a professor of general practice and family medicine at LMU Munich, and I welcome you to this program entitled COVID-19 and Oral Antivirals, How to Define an Eligible Patient. I'm very pleased to be joined today by Marta Bofito, who is a consultant physician at Chelsea and Westminster Hospital in London. Welcome, Marta. So we have an exciting quickfire program for you today, where Marta and I will ask each other questions and have only 60 or 90 seconds to respond. That's going to be tough. COVID-19 treatment eligibility is an important topic with lots to discuss. So let's get started with the first question. Marta, where are we now with incidence of COVID-19 cases? What are the current trends? You have 60 seconds to respond, starting now.
Thank you, Jörg. So this is a very important question because some people think COVID doesn't exist anymore. But if we look at the epidemiological data reported to the WHO, COVID is a very important infectious disease in the population nowadays. We see high rates of death globally due to COVID. If we look at the data reported in terms of global deaths to the WHO up to the beginning of November 2024, we can see approximately 3,300 deaths due to COVID over 28 days. So it is clearly a very important health issue. Also, the number of cases that are reported as positive for COVID is as high or even higher, depending on the season, of those reported for rhinovirus, influenza, and RSV. So COVID remarkably increases the disease burden among the respiratory viruses.
Well, thank you, Marta. But I have another question for you. What are the current COVID-19 treatment guidelines and recommendations? Can you guide us through those? You have again 60 seconds to respond.
Of course. So when we think about treatment guidelines, we need to think about patients that are not hospitalized and patients that are hospitalized, because these are very different. For patients who are hospitalized, different classes of drugs like corticosteroids, antivirals, monoclonal antibodies are used. But for patients who are not hospitalized, there are antiviral available for the treatment of COVID, and there are antivirals like nirmatrelvir, ritonavir, that needs to be taken within 5 days of the beginning of symptoms. Molnupiravir, that is available in certain areas of the world and not in others, which is also an alternative oral antivirals, or remdesivir, that is not available as an oral formulation but can be administered and taken within 7 days from the beginning of symptoms. These antivirals are very important to prevent the development of severe COVID in certain people. Jörg, now it's your turn to answer questions. My first one is, how has the eligibility for oral antivirals changed and evolved? 60 seconds.
Well, thank you, Marta. I think we still have all of the high-risk patients who are eligible for COVID-19 treatment. That hasn't changed, but we should focus more on this group now, because there was a certain time when COVID was dangerous for everyone, but now we should focus especially on patients who are at higher risk. we don't have any testing anymore, so we don't know exactly who is infected. So we also need to work on reminding everybody that if they have symptoms, if they have problems, then they should still test themselves so that we know for sure that it's COVID and can act accordingly. So the eligibility basically is good. We have enough drugs to use. We have still testing available if needed, but we should really focus on the patient. We should really address them personally because nobody's doing any regular testing anymore. So patients need to remember that when they do a test and they are positive, they should address the doctor. They should ask about possible treatments and about their personal risk situation.
Thank you very much. So, another question for you, because you did talk about treatment, how do you assess risk for severe outcomes and what risk stratification tools are available? 60 seconds, please.
Well, Marta, being a general practitioner and working in my practice, I don't use any regular tools to find us because I know my patients. I know their social, psychosocial background. I know their personal history. I know about their compliance. And I know about the diagnosis as well and their age and their personal risk situation. So I sum this all up together in a big bundle and I find out, is this a patient? I'm afraid that she or he might have a severe COVID infection and might also go to the hospital or even have more problems with the disease. So I put this all together. But basically, in our German guidelines, we have 3 risk groups. One patient group is the one who's actually not very much at risk, with only a moderate or lower risk, not any preconditions, good social situation, good compliance. But we have other groups who are at moderate risk, elderly patients, patients with preconditions. We should also have a closer look at. And in the end, they are the patients who are really at high risk. And I think we should have a closer look at those ones because they still really need a very close look and maybe even treatment. So Marta, let's switch the hot seat again. Back to you. Your turn again. Who is really still at risk of COVID-19? Which patients should we specifically address? You have 90 seconds because this is a tough one.
Thank you. Very kind. So, the majority of people who are infected with COVID have asymptomatic, mild, moderate respiratory illnesses, and they can recover without treatment. However, there are some key groups that are at higher risk for developing severe disease, as you clearly explained to us when you were talking to us about your patients. People above the age of 60, pregnant women, people with underlying health conditions such as obesity, diabetes, heart disease, chronic kidney disease are at a higher risk of developing severe COVID disease. Very importantly, people with certain cancers, especially blood cancers, people who are on immunosuppressive therapies and are therefore unable to build up an immunological response to the vaccinations, which is an incredible tool that we have available, but it doesn't work for everybody. So also, let's not forget about long COVID and the fact that certain people are at a higher risk of not only severe COVID, but also long COVID. Now, all of this to say is that it is important that we are aware of who these groups are so that as healthcare professionals, we don't leave anybody behind. If we know who needs antiviral treatment, we can really support people to get through COVID as soon as possible and without complications.
Very clear, Marta. Thank you so much. So your last question now, but still a very important one. What are indications for COVID-19 oral antivirals and who is defined as eligible for a treatment? You have 60 seconds again for this one.
So if we look at the guidelines in the UK, which is where I work, but they are very similar to the guidelines in many other areas of the world, the eligibility criteria for non-hospitalized patients cover obviously people who have a lateral flow test or a PCR that is positive within the last 5 days and have symptoms of COVID-19 and also are members of the high risk group. And as we both mentioned before, healthcare professionals and ideally patients themselves need to be aware of who these groups are. We're talking about people with Down syndrome, people with chronic kidney disease, people with uncontrolled HIV, people with solid organ transplant, people with blood cancers, and so on. So I think this is really important, as I said, not to leave people behind and to make sure that COVID is managed properly.
Thank you.
Now, your turn again, Jörg. How do you communicate risk for severe COVID-19 outcomes in eligible patients? You have 90 seconds to respond, please.
Well, first of all, you have to remain authentic, meaning that you should offer the treatment to the patient that you would also offer within your own family or within friends or close relatives that are at higher risk. So, of course, you should always stay authentic. You should not offer treatment to somebody who basically doesn't need it. But there are still a lot of patients who could profit from treatment and are at high risk, as mentioned by you. And we should also always remind ourselves and the patient that COVID is not only a respiratory tract infection, which is going from sort of the upper airways and maybe a little bit down here, but it's a full body, a systemic infection. We could also infect the blood vessels, the heart, but also the gastrointestinal system. So it's important we're not preventing coughing or sneezing or fever only. We're preventing a systemic infection. And the courses are mild, as you mentioned before, but still we have in our statistics in Germany, 14% of severe cases and a lot of critical cases as well, up to 5%. And we need to protect those patients especially. And the average age, everybody's still thinking that COVID is something for very, very old people, but it's not true. The average age in Germany was around 50 years, 52 years. So it's also young families and young people who are affected. I'm 52 right now, so I'm just in the middle. So I need to think about it as well. And during the course of the pandemic, those hospitalizations were occurring very often, but now they're less, but still they are there. So we need to address all those topics and talk to the patient openly about it. And then we might also offer them treatment if they feel that the necessity is there. If we feel the necessity, the patient also feels it.
Great. Thank you very much. Now, our last question is for you, Jörg. What are your best practice tips on how to assess risk and identify eligible patients in clinical practice? 90 seconds from now, please.
Well, first of all, look at the diagnosis, look at the ICD codes, look at the diagnosis and preconditions that we've mentioned in this talk earlier. Of course, there's no way around it. Those are the one patient we really have to look at. And then, but also take in account all the knowledge that you have of the patient, all of their personal history during the pandemic, and take this into account and make an individualized decision based on that one. And then look at the medication, because you have to see whether there's possible interactions with some of the available oral drugs. And there are good interaction checkers that you can use. For example, the Liverpool interaction checker, where you can really put in the medication and see whether the treatment is a problem with the other medication. But we've learned a lot about this in the pandemic, and those checkers are really good. So we can really find out whether treatment can be taken or not. And in my personal experience, in the vast majority of patients, it was no problem to use those antiviral drugs with the patient by either pausing the medication or lowering the dose. So this is an important step as well to take. And in the end, just look at the patient, think whether she or he is in danger, whether he or she has a history of severe respiratory tract infections, of systemic infections, of immunosenescence, and then just act on it and act fast within the first 5 days, because you need this time window to start the oral treatment and get the medication to the patient and help them out of this condition, out of this situation. And the patient will be grateful and thankful if they have survived a severe COVID situation due to your help and to your engagement.
Great. Thank you so much. So, if we think about the key takeaways from our discussion, we've clearly seen that COVID is still around. The majority of people might have a mild to moderate upper respiratory tract infection, but there are people at high risk for developing severe COVID. Healthcare professionals need to know about the importance of testing and antiviral treatment to prevent complications of COVID-19. We know what the categories of people are, and I think we have a responsibility to make sure they're supported, and we do not leave anybody behind in a society where COVID is very much present. Thank you very much for answering all of your questions, Jörg. Thank you very much, all of you, for your attention, for listening to us. Please continue on to answer the questions that follow and complete the evaluation.